This is an interesting story regarding football because in addition to the NFL and college games, seasons fully underway, we also have high school football, right? And I don't know if you caught this, but Boston University, they did what's now regarded as a landmark study on players, former football players who have passed away, showing all but one of them, all but 111 autopsies, that they at least had signs, if not full-blown CTE, which causes dementia. It's related to the brain injuries as a result of maybe playing football certainly for a lifetime or maybe a short lifetime for that matter. So much so, now on the heels of that, one of the orthopedic medical journals out there has caught the attention of, I think, the media in general, too, because it's kind of an eye-opening thing, is they're saying they are now urging surgeons to cut all ties with football. And that would be from Pee Wee football, Pop Warner football, all the way up through high school, through college, to the NFL because of traumatic brain injury, saying there's a connection there. And by doing this, by clearing athletically and physically players to play, we are encouraging them to encounter the traumatic brain injury that we see later on in life. So they're calling for physicians to not perform physicals for college players and professionals, saying that it is not consonant with the best values of our profession, according to one of the researchers. So the question is, if they're telling doctors now not to examine or have a hand in participating in allowing players to get into this profession or this sport, what does this say about the game? Joining me on 700 WLW, Dr. Sally Fryer-Dietz, and she is the founder of the Integrative Concussion Therapy in Dallas, and she's been involved in the study as well and other studies involving CTE. Dr. Dietz, good morning. How are you?
Good. How are you?
Everything's fine. All right. So the evidence in this so far, it seems to me to be pretty conclusive. That all the studies and research relative to CTE and traumatic brain injury that you've seen, that you participated in, Dr. Sally Fryer-Dietz, that the evidence is conclusive. Is that true?
Well, I've been involved in research that involves treatment, not in the diagnosis of CTE. However, there is plenty of evidence now that shows that we do have a big problem, and this is a real thing, and we need to be paying attention to it.
In that regard, is it limited to just football? Football tends to be, because of the nature of it, I think, the sport that everyone points the finger at and says, aha. But there are other contact sports and non-contact sports out there. And similarly, I'm guessing, are there also professions out there that expose one to CTE?
Absolutely. There's, the military, that's a big profession. They have a very, very high rate of brain injury due to blasts. There are many sports. Girls soccer is a big problem for concussions. So is lacrosse. So are a lot of our varsity sports, rugby, anything that involves high contact. But you don't even have to have a high contact sport to be vulnerable to a concussion.
Yeah, and I think that's the thing. Is it the nature of the repetitive aspect of the concussion, or could you develop CTE just based on one concussion, a single episode?
There's not enough evidence at this point to say absolutely if you do this you're going to get CTE. But what we do know is the repetitive nature of lots of hits, even subconcussive hits, can set you up to have lifelong brain injury. And everybody's born differently. We all have different, anatomy systems and how we're, more vulnerable than not to injury. But we know that repetitive hits are not good for you, especially in a developing body.
Yeah, and it keeps going and going. And so the nature is the more you have it, the more likely you're to get a second or third or fourth concussion. Seemingly that once you've had one, is it easier then to get subsequent concussions?
Yes, it is. It's actually statistically very high because your reaction time, everything is off, especially if you're not completely healed yet.
Yeah. So as far as the doctors being advised by, in this case, a top one of the medical journals in orthopedics, not to have any hand in either, maybe not treating, but certainly clearing someone physically for play, isn't that at odds with the Hippocratic Oath? I mean, it seems to me to be more of a headline-grabbing kind of thing, whereas when you apply it to physicians, most physicians probably are going to wind up doing the physicals.
Whoever wrote that didn't think this whole thing through, because one of the strategies for keeping our players safe is to have good medical assessment. So there are going to be high-risk things out there. You cannot cut off people in high-risk professions from medical care. That just doesn't make sense.
Well, it also undermines what physicians do, right? Because you don't get to pick or choose who you treat based on well, you shouldn't do that. It doesn't work that way. Otherwise, pretty much anyone who's used drugs or had a accident and speeding, you'd be very limited to your practice. Let's put it that way.
Absolutely, and I think part of the intention, possibly for the statement that was being made, is advertising your services in a big, football arena or whatever, that maybe there's a conflict there, much like if you were going to advertise your medical practice on a package of cigarettes. You don't want your name necessarily associated with promoting something, but at the same time, if we're trying to keep people safe, then we need to tap into our medical expertise to be able to have that available to everybody, including players of any age.
Yeah, it's a silly argument, but if the whole goal was to get people talking about it, well, congratulations. We are. Dr. Sally Fryer Dietz, concussion-therapy.com is her website. She's the founder of the Integrative Concussion Therapy Institute in Dallas, Texas, and has been involved with former players who are at risk with developing CTE. Do you see on the horizon something developing that is going to diminish CTE, or at the very least, is there going to be something out there, maybe not a magic pill, but a piece of equipment that's going to start to save players from these long-term injuries?
I think what's going to save players is having a bit of a cultural shift in the game. Certainly with children, we need to be protecting them, give them the benefit of all the good things about sports, and football is a great game if you're not hurting yourself lifelong. So setting the industry up of sports and athletics and everything by being healthier doing it. Having good baseline assessments, having good guidelines for play, and
right. But by the nature of it, at some point there's going to be contact, and guys are going to get hurt. I mean, let's face it, tonight, literally dozens of people are going to pay big money to go see the Bengals and the Texans down at Paul Brown Stadium, and there's going to be a lot of hard hitting, and people love that. I don't see it. There's people saying that football, the NFL especially, is going to go by the wayside someday. It's going to fall into favor like boxing. I don't ever see that day coming, certainly not in my lifetime.
Well, and it may not. And as an adult, you have a choice to do whatever you want to do.
Right.
And
you have free will.
People join the military. They know that the risk is death. Yet people do it, and we depend on them to protect our country. Same thing with sports. If you really want to play and you're an athlete at that high level and you want to play professional sports, you should have that right to do it. And you need to develop those skills when you're younger. I think the biggest problem with it is with developing kids, we need to figure out how we can develop the skills without putting them at risk for long-term health consequences.
As a doctor who studies this, Sally, are we starting kids with contact sports too early? Should it happen later?
Yes, we are. In my opinion, absolutely we are. I think we know enough now that there's no purpose in having kids butting heads against each other repetitively growing up. You're just asking for trouble doing that.
At what age is okay to start doing that? At some point, if we are going to have football around at the college level and the pro level, you have to start getting some training younger in life. At what age is it acceptable from a medical standpoint?
Well, the studies show that under the age of 18, you have a much higher risk of longer-term sequelae. So 18 is kind of the magic number based on the numbers of people that we've looked at.
Wow.
But, any age that is going to put kids at risk for having multiple injuries, you've got to have that conversation about, is this really worth it?
Yeah. I wonder what this is going to do for youth sports. I mean, you're always going to have college and pro. There's money. There's scholarships at stake there. There's no doubt about it. But you wonder at what age and how many parents in the future are going to be going, I don't know. When we have Hall of Fame football players, running backs, saying that I'm not going to let my kids play contact football, I think that speaks volumes.
Right. Well, they know what it feels like. And we work with a lot of these guys, and they've got their bodies hurt. When you look at an older football player, you can watch the dysfunction in their body walk down the hall.
Well, I didn't play professional football. I'm 50. I'm a train wreck. So I could imagine being an former NFL player, the pain that you live with on a daily basis, or a professional athlete for that matter. Dr. Sally Fryer Dietz, concussion-therapy.com. Thanks again for the time. Appreciate it.
Thank you.